Hello, my name is Juan Ramirez. I'm going to be doing a video on NG tube placement. So first I'm going to check the patient's orders. Make sure he has an order from the doctor to place a NG tube. So I checked the orders and he does have an order. I'm going to go ahead and gather my supplies. I have my tubing, my cup with the straw and water, my syringe, lubricant, some tape, gloves, a flashlight. I do not have a water bin. I do not have a towel. I do not have a pH strip. I do not have an elastic band. I do not have a suction. I do not have a safety pin. And I do not have a canister. So now that I have my supplies ready, I'm going to go ahead and do the process for the NG tube. I'm going to go ahead and perform hand hygiene. Okay. I'm going to go ahead and put some gloves on. Okay. Hi there, my name is Juan. I'm going to be your nurse today. The doctor ordered a NG tube. It's a tube that's going to go through your nose to your stomach to deliver some nourishment. Is that okay to do? Yes. Can I get your full name? Okay. What's your full name? Michael Smith? Okay. Yep. Michael Smith. What's your date of birth? 23585. Okay. That's correct also. Okay. I'm going to go ahead and provide some privacy. I'm going to sit the patient at a high faller position. So I'm going to go ahead and sit him up. Okay. I am going to go and put a towel on his chest. Okay, the towel is there. I'm going to go ahead and examine his nose. I'm going to have the patient hyperextend his neck back, his head. So I'm going to check the nose for any occlusion. Make sure there's no occlusion. Make sure there's no irritation, no blockage, nothing that will block the tube from going in. So it looks like it's pretty good. Okay, I'm going to have the patient blow their nose. Okay, blow, blow, blow. Good job. I'm going to have the patient, I'm going to cover one side and have them blow. Okay. I'm going to cover the other side and have them blow. Okay. I'm going to select the right side to place the NG tube. Okay. I'm going to go ahead and measure my tubing. And before I started examining the patient, I would place my tubing in warm water so it can loosen it up and be more flexible. So when I do put it in. So I'm going to measure from the tip of the nose, okay, to the tip of the ear. And then we're going to go to the tip of the xiphoid process tip, okay. And we're looking at 40. So I'm going to go ahead and mark it with the marker so I know where to stop. Okay. So I got my tube ready. So I'm going to go ahead and put some lubricant so it goes in easier. Okay, so I'm putting the lube in. I'm going to have the patient hyperextend their head back. Okay, and I'm going to go ahead and take a deep breath on 3. 1, 2, 3. Okay. I'm advancing the tube. There's no resistance. There's no blockage that I feel. Okay. Now I'm going to have the patient tilt their head forward. And I'm going to have them sip from the cup if they're able to hold it, or have the CNA assist me holding the cup. So they're tilting their head forward. And I'm going to have them take a swallow. And when they swallow, I'm going to advance the tube. And they're tilting their head forward. So swallow. And I'm going to continue advancing the tube. I'm advancing it. Take another swallow. Okay. So they're suctioning from the straw with their head tilt. And I'm advancing the tube. and it's going in, and I reached 40, so I'm gonna stop there. So now I'm gonna check for placement. There's a different way to check for placement. You could put some air and auscultate the abdomen, make sure that you can hear the air. You could also aspirate fluids from the stomach, and you could test it with a pH strip, or you can order an X-ray and see where the placement is. Okay, so what I'm gonna do, I'm gonna go ahead and administer between 5 to 20 mLs of air. Okay, and I'm gonna go ahead and listen. I'm gonna put this in the abdomen. Okay, I'm gonna go ahead and roll. Okay, so I hear the air there, so that's a good indicator that it's in the right spot. Okay, I'm gonna go ahead and secure. Okay. Okay, so I have it secure. I'm gonna go ahead and get a safety pin or another piece of tape, and I'm gonna safety pin it to the gown or tape it to the gown. Okay, and that is the process of inserting an NG tube. Is there anything I can get for you right now? No, okay. Okay, here's a call light. If you need something, go ahead and call me. I'll check on you in a while. I'm gonna let the doctor know that we placed an NG tube. I'm gonna go ahead and gather my supplies and dispose of them. Okay. Get rid of all my materials. I'm gonna perform hand hygiene. And we're done.